Carrie Bevis. I am a gynecologic oncologist.
My name is Nana Bentum, and I practice with East Alabama Maternal Fetal Medicine.
My name is Dr. Njideka Obi-Ekwe. I am a board-certified OBGYN.
I'm Dr. Cynthia Lorino. My specialty is I'm a diagnostic radiologist with breast imaging specialty.
Carrie Henserling. I'm an OBGYN.
In a nutshell, what GYN oncologists do is specialize in treating patients with cancer of the reproductive tract. GYN oncology is an extremely specialized area of medicine that is not widely available to many patients. And so particularly in the state of Alabama, just in the amount of time that I've practiced this specialty and training, and then as a practicing physician, I've seen the transition from a situation where the only opportunity to really get GYN oncology care in the entire state was in Birmingham.
And the fact that now the Auburn, Opelika, Lee County area has Spencer Cancer Center here is just a blessing. Because so many of the people that were in Birmingham with me were traveling even further than I was, for treatment and regular checkups.
The thing that excites me the most is that now as this area grows, I'm able to bring those services and that level of care to the patients where they are, instead of having them travel hours upon hours to get the care that they need for the cancer that they have.
A lot of people don't know what maternal fetal medicine is, and it is essentially the care of a high-risk pregnancy, and a pregnancy can be high risk for a variety of different reasons. One could be because the mom has a high-risk issue such as high blood pressure or diabetes, but also it could be because the baby has a high-risk issue. We also help in terms of providing very detailed ultrasounds as well. And so we partner with a patient's OB, so they still see their general OB, but then they come to see us either for a specialized ultrasound or for specialized care regarding their high-risk pregnancy.
I started seeing Dr. Bentum last summer due to reoccurring miscarriages. I had a total of 3 between my 7-year-old daughter and the baby that we have now. I took a leap and I came, and it was the best decision I could have possibly made.
I grew up in Auburn, and one of the things I wanted to help with is providing good care close to home where people can conveniently access excellent care. And so that brought me back to this community.
I'm getting chills right now thinking about it, and I lay there and I just pray to God, let it be something good. And Dr. Bentum was sitting there, and they showed me the ultrasound, and I just started crying. And the first thing they said was, "Are you okay? Why are you crying?" And I said, the positivity in this room and seeing y'all's faces and the happiness that I'm seeing is not something I've experienced in the past, 3 years that I've been trying to conceive my baby. So just being around so many positive women that were here for me, to feel good every single week, to smile at me every week, that alone was all I needed.
We do total women care. It's providing services for women of all ages. We have the puberty, the teenagers, we have reproductive age women, and then we have menopausal women. So each stage needs different stuff.
I think in my particular profession or field, I have the unique opportunity to see young girls as they're just starting to visit gynecologists for the first time, whether they're having health issues or just for kind of routine initiation of care. Then I have the opportunity to see these same women as they start families and have childbearing, and then I have patients that obviously are their mothers or their grandmothers that I see. So I'm able to truly see families all across the spectrum of ages.
We want to be here for the women. We want to make things as easy as possible for them, as well as the referring physicians. They can come one place, get their mammogram, get the ultrasound, get their biopsy if they need it, get breast MR if they need it. And then we're going to provide a whole new level of care once a diagnosis is made, so that we can make the journey for that patient as easy as possible.